Loss comes in many forms, and usually in unexpected ways. It can be devastating, leaving you facing an uphill struggle to go on with life without someone you thought would always be there. But life does go on, and even in the deepest despair, we can find hope. Welcome to Grief Relief with your hosts, Drs. Gloria and Heidi Horsley, brought to you by the Open to Hope Foundation, helping people find hope after loss. And now here's Dr. Gloria and Dr. Heidi.
Hello, I'm Dr. Gloria Horsley with my daughter and co-host,
Dr. Heidi Horsley.
Welcome to the Grief Relief Show.
The reality of suicide is a very complex reality, and it's one that can't be usually covered in a sound bite or a very short explanation.
Suicide is a behavior. It's not a disease, it's not an illness, it's not something that you can catch from your friends.
Most of us don't think about suicide until it touches our life.
Well, my dad died by suicide in 1990. My reactions, in addition to the usual shock and profound grief, was to want to go to war, to get revenge about what killed my dad. And of course, with suicide, you can't physically attack it, so I've decided to attack it through science. I believe that that's the only way that we're ultimately going to get a handle on this massive international killer.
I'm working in the field of suicide prevention because I believe that we can help people choose life. I can't imagine anything more devastating along your life path than that. So I'm drawn to help because I believe we can.
I am primarily a clinician and have worked with patients who are suicidal basically almost all the time, and have been touched by both families who have lost their family members to suicide, as well as have worked with patients who've died by suicide.
AAS is the one place that, in my experience, that allows the sharing of ideas.
This organization really is a family, and we have come together not only because of a common interest, but because we all share a passion, and that passion is to prevent suicide.
This is really the place where people come to for the knowledge that moves this field forward.
No matter what you do within the broad field of suicide, there's something for you.
Well, Vanessa, welcome to our show today.
Thank you. Thank you for having me.
Yeah, this
Hi,
American
Vanessa.
Association of Suicidology, you do some work with them, right?
Mm-hmm.
And I know one of the things that people are concerned about after they've had a suicide in their family or other suicides. You know, there may be other suicides in the family. And do you work with that kind of thing?
Yeah, I see. I'm a clinical psychologist. I deal a lot with survivors of suicide, family members, and oftentimes they're worried if they lost their husband, if they lost their sibling, you know, what will happen to my children, what will happen to my other relatives. And unfortunately, there is a slightly higher statistic of family members dying by suicide, you know, after there's been a suicide. So it's always a fear, you know, I sort of deal with how much of a fear, or whether to get other people help if they need it, you know, and how much you have to live with the uncertainty that you know is a reality after you've lost somebody from suicide.
You know, I like one thing that when we talk about this, Heidi, that Vanessa normalizes this, that it would be a normal reaction if you've had, you know, because, you know, sometimes we think when these things happen that they're not normal reactions to things. I know one of the things you're doing for the American Association of Suicidology is you're working with therapists who actually deal with suicide.
You were talking earlier about how stigmatizing loss to suicide is, and one of the groups that feels the most stigmatized is a clinician who's trying to help somebody and then they lose their client or their patient to suicide. You know, family members have trouble talking to their friends, their colleagues, but clinicians have confidentiality issues and have fear of lawsuits. So it's a very difficult grief to move through.
That's so interesting because as a psychologist myself, it is our biggest fears that, you know, one of our clients will die by suicide. Especially when you have some clients that have suicidal ideations and kind of, you know, have clinical depression, etc.
Right. And we have so much responsibility. We feel so much it's our role to help them. And so if they die by suicide, you know, it's our fault. What do we do? Unfortunately, sometimes we have colleagues who are thinking those same things.
Well, and I'm thinking, you know, here we are as psychologists, and even we can do everything we can do for our clients and sometimes miss the signs. So I'm always saying to families, kind of don't be so hard on yourself, because, you know, when people are going through a hard time, they're often very good at hiding it or not disclosing. Because I know for families, they often put a lot of pressure on themselves. We should have known more. We should have reacted differently. Why did we miss those signs? And what do you say to families that kind of have those kind of guilt feelings?
Asking those questions are part of the grieving process for a suicide, and I'm open to listening and talking about those questions for as long as they need to ask them. But I think eventually it sort of shifts into thinking about the person's life, thinking about the good things they had, and not so much in terms of how they could have seen something or prevented something.
You know, I recently read a study that was done that, it was in New York, I don't remember the exact hospital, but they found that half of the people that attempted suicide and completed it had been in therapy. And the call that this therapist gave, you know, the study, the head of the study was, we do need some new methods of working with suicidal people. So one of the things that I think people have to realize is that having your family member in therapy is not a guarantee that they're not going to kill themselves or complete a suicide.
And that's one of the things that's great about the American Association of Suicidology. It's so many great thinkers from different fields coming together saying, how can we prevent a suicide? It's academicians, it's researchers, it's clinicians, it's crisis workers, and we all sort of get together as this think tank and really work on the prevention of suicide. I think, if I can say, I think that the training could be improved for all of the mental health workers in terms of how to assess, how to treat suicide. I think there's also, unfortunately, a reality that some people are going to take their lives, and as clinicians or family members, we may not be privy to that. You know, the people may not want us to be privy to that. I often say that I think that people have two tracks. Part of them wants to live, and part of them wants to die. And if we're sitting and assessing where they are, they may well be on that I want to live track, you know, and you're doing your best. You're finding out information. It's just that a day or two later, they may be in a different place.
Well, that's something to tell the families to think about. Those what you're talking about now for clinicians is so important for families to realize that, you know, there is this, you know, balance going on between the two. Yeah. Now, what, as a layperson, what would there be for me if I had a suicide with the American Association of Suicidology? Do you have conferences, walks? What kinds of things do you do that I could get involved in? Because I'm thinking that if I've had a suicide or a drug overdose or whatever, one of my family members has died, and I'm not even sure if it was suicide or not. I have a lot of that happen at Compassionate Friends. A lot of people come in and they're not sure whether their family member really did take their own life. Are there things that I can do to give back? I know the Figelbaums wrote a book and did research, and what could I do that would be smaller? Can I walk? Can I do something to help?
The American Association of Suicidology doesn't have walks. The American Foundation for Suicide Prevention does.
So I could do that.
You could go to that website. There's a conference that we hold every year, and part of it is sort of a larger, more academic conference, but there's a healing day, which this year is going to be April 12th in Los Angeles, if people are interested in going to that. And it's a full day programming. There's usually a main speaker that talks about their loss or the great things they've done through their loss, you know, in terms of making foundations or doing research. And then there's breakout groups where you could meet based on your relationship. If you've lost a sibling, if you've lost a client or a patient, if you've lost a parent, there are, you know, support groups. And then there's a couple of other things like art therapy. You might be able to see a film. So it's a full day programming for people who are grieving a suicide.
I love this idea because I feel like, as we've talked earlier on the show, people that have had someone die by suicide get so little support from just the outside. And to be in a place where other people, to a certain extent, can relate to what you're going through and can relate to the fact that you're not getting support and be there to support each other, I think is very powerful.
Yeah, I don't know if you know this, but I lost my sister 9 years ago to suicide.
No, I didn't know.
And being a new clinician and feeling very abandoned, I guess, by many friends and colleagues, I really didn't know where to turn, and I happened to find something about the American Association of Suicidology. It was in Colorado. I'm a New Yorker. I'd never been anywhere else but New York and you know, the West Coast. And I went out to Colorado, and it was really like a home. It was like, wow, here's a place where I can grieve and where people understand me, both as a professional and a family member, how to grieve a suicide.
Well, thank you so much for coming on the
You're
show
welcome.
today and sharing all this with us. It's
Yes, thank you
been
for
an
the work
amazing
you're
show.
doing in tribute to your sister, and I'm so glad you shared that piece with us. As a brief sibling, I can identify with losing a sibling and how hard it is.